when I had my first son at 19, I had a horrible birth experience. I was delivered by a nurse midwife who was not my color. I had a nurse who was not my color, and she didn't advocate for me. At one point, I went into it not wanting the epidural because I was afraid of needles. But again, I wasn't educated. And when I did ask for one, the nurse midwife wouldn't come check me, and a new grad nurse didn't advocate for me. And so, of course, I was rising in bed in pain, and they came in and told me they would put me in restraints if I didn't control myself. And so it got to a point where I was able to finally push. And so when I pushed, I actually tore myself towards the end when they said that his heart rate was dropping because I pushed without a contraction with all my might to save my baby. And when it came time for her to repair me, again, I said that I didn't have anything for pain, no epidural. And so I grabbed her hands with her gloves, where I know vaginal deliveries are supposed to be clean, but she should have changed her gloves because I had touched her. But she just smacked my hand out the way and said, "This will only take a minute," and began to stitch me up without any medication, no local anesthetic. I didn't have an epidural, nothing. And that was I had a very traumatic experience. Nobody came in my room to see me on postpartum to do an assessment, so they must have just lied on the documentation. The only person that actually came in, sat on my bed and talked to me was actually the housekeeping ladies. And that horrible experience led me to know that I wanted to impact other women's birth experience. I didn't want them to have a story like mine. So I sought out to become a nurse midwife.
So although the discussions about race can bring anxiety and feelings of discomfort for individuals, it's really important that this is a step to create safety and combat implicit bias. For example, historically, reproductive oppression has included the advent of the study of obstetrics and gynecology in general, where use of enslaved Black women's bodies were used to perform and improve obstetrical techniques that we use today. There was also evidence of forced sterilization and the promotion of birth control among low-income Black women. And there was also, and this continues to this day, ignoring at times Black women's pain. Aligned with that is the perception that Black people in general have a higher pain tolerance. Governor Whitmer has prioritized health equity and elevated the Black voices in Michigan. In 2021, the state of Michigan also had added, as part of the public health code, that healthcare licensure is now linked to mandatory implicit bias training. So in order to get your license as a nurse, as a clinician, you have to have implicit bias training. And this certainly will help impact maternal morbidity and mortality.